Everyone. Thank you so much for joining us on this call today. I'm Deborah Kafori, your Multnomah County Chair, and I'm grateful to be joined today by the truly impressive healthcare leaders who have steered our collective fight against COVID-19, from our own Multnomah County Health Officer, Dr. Jennifer Vines, to leaders from the 4 major regional health systems who have been on the front lines during our darkest days. Doctors Edwards, Giswold, Podolsky, and Olson. In addition to treating COVID, you have built a remarkable collaboration to vaccinate our community. And I'm also honored to be joined by an educator and a state lawmaker, Superintendent Guerrero and Representative Dexter, both incredible partners who have worked tirelessly, sometimes thanklessly, to help our families and our community endure the immense challenges of the COVID-19 pandemic. While they've all seen firsthand the harms, disruption, and pain that so many have experienced over the last year and a half, our collaborators have also had a central role in helping our community make great progress against the virus. But with the emergence of the Delta variant, we are at risk of losing the gains that we've made together, which is why we've called this conference today. Today, I'm announcing an executive order that requires everyone 5 years of age or older to wear a face covering in all indoor public spaces, regardless of whether they have been vaccinated or not. This is in effect on Friday, August the 13th, and it will be enforced. We'll enforce this mandate like we do our tobacco regulations. The process will be complaint-driven and will involve a series of escalating steps from education on up to a $1,000 fine. And we'll be sharing more of that process later this week for the public to report issues either online or over the phone. Why are we taking this difficult step now? It's because we know that masks work. They are tried and true, they are affordable, and they're an effective way to limit the spread of this virus and its variants. And until enough of us are vaccinated all across Multnomah County, masks remain one of the best strategies that we have to keep each other as safe as possible. This executive order builds off Multnomah County Public Health's late July recommendation, which we made as we began to see a resurgence of COVID-19 cases fueled by more social activities and most notably by the Delta variant, which we know is much more transmissible. The variant has undeniably changed the terms of our engagement with this pandemic. This executive order represents an urgent, necessary pivot in what we can and must do as a community to slow the spread and save lives while we continue to get our community vaccinated. We've heard from many members of our community who have expressed support for the clarity, gravity, and the enforcement of a mandate. Today's action brings consistency to expectations and minimizes confusion in the public indoor spaces across our county. But more importantly, it is a measure that we must take to protect each other, all of us, from a variant that is ripping through communities. It's a step we have to take to keep our kids safe, especially those who are too young to be vaccinated, as well as their teachers, as we get ready to send children back into classrooms next month. It's about keeping community members who remain vulnerable, including those who have not yet been vaccinated, protected as much as possible from severe illness that requires hospitalization, and in the process making sure that our hospitals have the capacity to help people experiencing other life-threatening circumstances. It's about protecting frontline workers, our family members, neighbors, and friends who perform work that is essential to keeping our community moving. We know that the widespread use of face coverings can and does work to bring cases down. But I want to be clear, the best, most effective step that people can take to protect themselves and to protect each other is to get fully vaccinated. The vaccine is safe and it works as it should. It prevents severe illness, hospitalizations, and death. And I also want to note that Multnomah County will be implementing the state of Oregon's vaccine mandate for healthcare workers to be vaccinated or to undergo weekly testing. Many of our employees, both in healthcare and elsewhere in our county, are fully immunized. And with that, I'll also want to note that I've asked the governor to broaden that mandate to include people who work in corrections and law enforcement. We are at a critical juncture in a pandemic shaped by community-altering moments. We have the tools, vaccines, and masks, and we have the science to fight back against the surge. So it's up to all of us to lean in again and even further into our sense of connection and our concern for each other, to muster up the tools, muster up the will to use these tools and recover the progress that we had been making before this variant. And with that, I will turn it over to Multnomah County Health Officer, Dr. Jennifer Vines.
Good afternoon, everybody. This is Jennifer Vines, the Multnomah County Health Officer. Thank you, Chair Kafori, for your leadership throughout this pandemic, and special thanks to our partners who are joining us here today. I'll just offer some brief remarks specifically about the Delta variant, and just to be very clear on where we find ourselves today. So this is a version of the COVID-19 virus that emerged earlier elsewhere on the globe and has made its way to Oregon as we expected it would. It was expected to be the dominant strain locally by August, and that has in fact turned out to be true. It is more contagious, up to 3 times more contagious, and there's some early evidence that it may cause more severe disease. And unfortunately, some of that disease is manifesting in younger people who have yet to be vaccinated. I want to be really clear that the vaccine is outstanding. It has a tremendous safety record. It does its job in preventing severe disease and hospitalization, but we're learning that in the setting of the Delta variant, it will not prevent all infections. So a vaccinated person may still get a mild infection and therefore may still be contagious, which is why we're asking everyone now to wear a mask indoors in order to slow the spread. We're hoping to slow the steep curve that we're on, a curve that was at about 100 cases in Multnomah County in mid-July and is approaching 1,000 cases a week. I should say 100 cases per week in mid-July and approaching 1,000 cases per week as of early August. That's an order of magnitude. We want to be entering the fall, the respiratory season, the school year in better shape than we're in now with respect to our hospitals, families' confidence in returning their kids to schools, and keeping our businesses on the roads to recovery. I want to be clear that we are not trying to prevent every case of COVID-19. That's not possible. It's not realistic. We need to slow the spread with the tools we have, which right now are vaccine and masks. And I want to thank again the partners who are here today and hear more from our health systems by turning it over to Dr. Renee Edwards.
Thank you, Dr. Vines. I've been here many times asking for your help. And as everyone has said so far, frankly, we need your help now, really more than ever. Our hospitals are finding themselves at their fullest capacity, and we will rapidly reach beyond the tipping point if we don't act immediately. And tragically, if we don't do something today, more people will die because we will not be able to serve the Oregonians who need hospital care for COVID-19 and other urgent healthcare conditions like heart attacks and strokes. This is because the Delta variant is indeed spreading throughout Oregon, just like the wildfires that are ravaging our landscapes. Vaccinated people can get the virus and spread it, but you are much less likely to become severely ill or die from the virus. Getting vaccinated is the single best thing you can do over the long term. Protect your health and protect your neighbors and friends. But wearing a mask beginning now provides the immediate protection that Oregon needs. And I want to tell you that you can make a big difference if you wear a mask, whether you're vaccinated or not. If you're not vaccinated, I would ask that you limit your activity as much as possible because you are putting yourself and others at significant risk. I also want to take a minute to address the kids in our community who are not yet able to get vaccinated. Unvaccinated people are spreading the virus to our children. And even though kids are not as likely to get severely sick or die, we just don't want them to get the virus because it can still potentially impact their health. And we don't know yet about the long-term impacts of having had the Delta variant or COVID-19. I want to note that our immunity level as a state, when considering previous infections and the number of Oregonians vaccinated, actually makes us the 6th highest risk in the nation for new infections. And this is very troubling as we battle this Delta variant surge. But if we all mask now, we will lower the number of people who need to be hospitalized, and that will give those who still need to be vaccinated time to get their immunity through vaccination. We need less Oregonians to need our hospitals for COVID-19 so that we can help your family and community members that need us for a car accident or a heart attack or a stroke. Please don't think of masking and personally distancing as a closed Oregon, but instead think of it as keeping our hospitals open for our patients and limiting the spread of the virus so that our schools can be open for our kids. Now, many of you are hearing this news and wondering what to do, and we know what to do. To limit your risk of getting this highly contagious COVID-19 Delta variant, our experts recommend following at least 2 of these 3 precautions, whether you're vaccinated or not. Wear your mask, always indoors, but also outdoors in group gatherings where vaccine status is unknown. If you need to gather, do it outside. It is safer than inside gatherings, and physically distance whenever possible. OHSU stands by Multnomah County's mask mandate. OHSU believes the entire state should be masking. I recognize this is being decided at a local level, but every community's actions will lead to consequences at a state and even a global level. Every mask matters. Every vaccine matters. Every choice you make to avoid crowds and avoid being indoors unprotected matters. OHSU is Oregon's academic health center and serves the entire state. We stand here with Multnomah County and our colleagues at the metro area hospitals, but are asking every county in Oregon to consider mandating masks and recommends physically distancing whenever possible, especially when in groups without clear vaccination rates. Oregon has successfully stemmed this tide before, and I'm truly sorry that we're asking you to do it again, but it really must be done. Please protect yourselves and those who cannot protect themselves with the safe and effective COVID-19 vaccine, including children younger than 12 and the immunosuppressed in our communities. Please get a vaccine, wear a mask, be safe. Thank you. And now I'd like to turn it over to Dr. Mary Giswold, the Associate Medical Director of Hospital and Post-Acute Care for Northwest Permanente.
Thank you, Renee. Our hospitals at KP are very full, and we have long waits in the emergency rooms. Our staff in our hospitals are weary, they are tired. These days, we often have patients waiting in the emergency department for long periods of time to get an inpatient bed. And we are having regular conversations about having to cancel surgery and procedures. We do not want to delay care for people in the community. For the safety of our staff and our patients, we are going to be further limiting visitors in our hospitals to help reduce the transmission of COVID-19 to our patients and our staff. As COVID cases increase, the virus has more opportunity to turn into a more dangerous variant, which can be even more transmissible and less responsive to vaccines. The pandemic is not over. Please encourage your family members, your friends, co-workers to get vaccinated and to wear masks. Please get tested and isolate if you have symptoms. We are not through this yet, and vaccines and masking are necessary to end the pandemic so that we can get back to lives as we previously knew them. Thank you very much. And now I'd like to turn it over to Dr. Podolsky from the CMO of Legacy Health System.
Well, thank you, Dr. Giswold, and thank you to the entire community for inviting me here today to represent Legacy Health. This terrible global pandemic continues to challenge our health systems and those we serve. And just as you heard from my colleagues before, we too are at critical census and asking for public help. As a parent, a community member, and an emergency physician, I'm grateful for the incredible work that has been done by all. I also want to share what I'm hearing from colleagues at the bedside, in the emergency department, the intensive care unit, and the general medical surgical floors. Delta is different. There are more infections, sicker patients, and higher transmissibility. And at the bedside, these incredibly sick patients, minutes away from needing a ventilator, are remorseful that they were not vaccinated. They're clamoring and asking our caregivers if they can now receive one. And it is the message when we heal them that they want us to share with our community members who have not yet received a vaccine. Together, we can beat this terrible virus. And Legacy Health stands behind all initiatives that save lives. Vaccines and masks save lives. Social distancing saves lives. So please protect one another and follow these guidelines. And we appreciate the support from Multnomah County and others. Thank you for your help in protecting your neighbors, your loved ones, and all of our community members together. Thank you. I'd now like to turn this over to Dr. Olson from Providence Health.
Thank you. I'm not sure I have a lot more to add than what's already been eloquently added from our other hospital partners, except to validate that these same trends are occurring in our Providence hospitals. We too are struggling with the ability to find enough staff to take care of the folks that are coming to us for care. The surge of cases in COVID is creating tension amongst our staff as to our ability to take care of the non-COVID patients. The ED waits that were just described by Dr. Podolsky were very much a problem for our Providence system as well. We have seen over and over again that with this pandemic, that when we use these public health tools, they do reduce the strain on the hospital systems. And at Providence, we too support the decision by the Multnomah County leadership to pursue the masking. And we also, with our healthcare partners, would like to see the social distancing and vaccination efforts improved in order to protect the care of our patients and our staff and our population in general. And so with that, I'd like to turn it over to our Portland Public School Superintendent, Guadalupe Guerrero, to speak to the issues in the school system.
Good afternoon. As Superintendent of Portland Public Schools, responsible for nearly 50,000 students and close to 9,000 employees, I want to start off by thanking Chair Deborah Kafori for today's action and an announcement to require all people across Multnomah County to wear masks while indoors. I believe this action, one guided by public health experts, is an assertive step we can all take to step up our community effort to protect the children, youth, and families of our county. As leader of the largest school district in the state of Oregon, I'm proud of how our teachers, staff, school, and district leaders have adapted time after time to the dynamic nature of this pandemic. We have made incredible pivots in how we deliver instruction. We have done our best to fulfill our core mission of educating students. We've maintained a focus on providing a continuity of learning while attending to our children's social emotional needs. We've worked to adopt and implement every measure possible to protect the health and safety of our students and families. And as one of the region's largest employers, that of our dedicated employees and many community partners. And as educators by profession, from the very beginning, we have said we would be guided by public health experts, not politics, not the loudest expressed perspectives, not popular opinion. Today's decision by Chair Kafori is yet another example where collectively, as a community and a broader ecosystem, we're being guided by our public health experts and making the best possible decisions to prevent the further spread of COVID across the county. On September 1st, Portland Public Schools will fully reopen our schools, with our students receiving in-person instruction 5 days a week. And while indoors, everyone will continue to be required to wear masks in every PPS school and administrative building. In addition to requiring masks, we're implementing a set of health measures, including the continued promotion of the COVID-19 vaccine, 3 feet of physical distancing to the extent possible, increasing the effectiveness of ventilation and indoor air quality in schools, COVID-19 testing for symptomatic individuals, isolation and quarantine protocols, regular cleaning and disinfection, and regular hand washing. Measures that, when all layered together, protect against COVID-19. So now more than ever, it will be important for all of us to listen to the guidance of our public health experts and take the necessary steps to stay healthy and safe against COVID-19. Further curbing the spread of COVID will require all of us, not just schools, businesses, neighborhoods, and families, to do everything we can to protect one another and minimize any further disruptions to learning and all of our day-to-day activities. Let's all wear our masks for the benefit of our students and our entire community. We appreciate the ongoing support, firm guidance, and expert opinion from the Multnomah County Health Department as we prepare to welcome back students and staff back to in-person instruction. Thank you. And now, it's my pleasure to introduce someone who I know shares our deep care and concern for children and families, State Representative Dr. Maxine Dexter, double agent.
Thank you, Superintendent Guerrero. First, thank you to the public health and medical professionals here today for your leadership and the innumerable essential workers who have heroically served on the front lines throughout this pandemic. I see you, and I'm grateful for your courage and dedication. Next, I commend and give my deep thanks to Chair Kafoury for her leadership in reinstating universal indoor masking in Multnomah County. This decision today will save lives and will help prevent further infection and spread. While I come here today as a legislator, I'm also here as a physician. I have been on the front lines of this pandemic from the very beginning. I care for patients in intensive care units with COVID-19 pneumonia, and like all my colleagues who practice in critical care, have repeatedly seen the tragedy of lives unnecessarily lost. These deaths feel very personal to those of us caring for people every day, and its unrelenting persistence is taking a tremendous toll on our healthcare community. Over the past year and a half, it's been everyone's collective sacrifices that have saved thousands of lives across Oregon. Thank you to the millions of Oregonians who have made the decision to get vaccinated. More than 75% of adult Multnomah County residents have been vaccinated, and it remains the most important thing you can do to save lives. Since mid-June, the highly contagious Delta variant has changed the nature of Oregon's fight against COVID-19. Hospitalization rates and number of intubated patients, as you have heard, are rising. Tragically, the vast majority could have been prevented by being vaccinated. It is critical now more than ever that each of us does everything we can to prevent the spread of COVID-19. Unfortunately, due to the Delta variant, compulsory masking when indoors is again necessary to safeguard ourselves and our communities. Vaccination is the most potent tool in our kit for fighting this pandemic. However, masking is the most immediate step we can take to all together help stop the spread. Vaccination is free, safe, effective, and widely available. If you find yourself struggling with the decision to receive a vaccine, please understand your decision impacts not just your own health, but the health of others, the health of my children and yours. As a physician, I have had many conversations with my patients that have led to their accepting the vaccine despite significant concerns. It's important to take time to discuss your concerns with your trusted clinician. We all want to have these conversations with you. We have seen what this infection can do, and we care about you, keeping our patients safe. When I'm at the hospital and in clinic, my job is to care for my patients. As a legislator, my job is to care for my constituents in my state. It is my duty to leverage my expertise in the medical field to advocate for policies that will protect people. Policies like universal indoor masking. We are fortunate to live in a time of unparalleled scientific knowledge and discovery. As our understanding of how to combat this pandemic evolves, so must we. We, as lawmakers, must be willing to adapt our positions and our policies to the science with a common goal of preserving the safety and health of all. Today, that evidence shows we urgently need to mask back up. As we continue to navigate these unprecedented times, we need national, state, and local leaders to rise to the occasion, like leaders here today in Multnomah County, to follow the science and to implement and voice support for safety measures like masking and vaccines that keep communities safe from this deadly virus. Thank you.
Thank you, everyone. And if the speakers want to start their videos,